Just as in adults, when a child's heart stops beating, blood stops flowing through the body. But CPR can help keep a child's blood flowing until other medical care can be given.
Can I help you find anything?
Oh, no thank you. I'm just looking.
Let me know.
Okay. Boys, stop running through the store. Get over here.
You can't catch me. Oh, that's what you think. Mom, come quick.
Boys, what happened?
He fainted again. Found him on the floor. I thought he was just kidding, but he's all waking up, Mom. Help! Somebody help!
What's wrong, ma'am? Are you okay?
No, my son.
Are you okay? Are you okay? Call 911 right now.
Okay.
Welcome to the Child CPR AED module of the American Heart Association's Heart Saver First Aid course. CPR AED is mostly the same for children as for adults, but there are some differences, so we're going to go over those now and then give you a chance to practice a complete sequence of Child CPR AED. Before we get started, let's explain what we mean by child. For the purposes of this course, a child is anyone who is older than 1 year and has not yet reached puberty. If there's any question about whether or not the person has reached puberty, treat the person as you would an adult. As we mentioned before, compressions are the most important part of CPR. One difference between adult and child CPR is how compressions are done. When giving compressions to a child, you may only need to use one hand. However, you should still be able to push down about 2 inches. If you can't do this with one hand, then use two. As in adult CPR, sometimes people don't push hard enough during child CPR because they don't want to hurt the child. However, it's better to push too hard than not hard enough. An injury is better than death. Children often have healthy hearts, but even a child's heart can stop beating if she can't breathe or has trouble breathing. So it's very important to give breaths as well as compressions to a child who needs CPR. Just as in adult CPR, opening the airway correctly will help keep a child's tongue out of the way to make sure your breaths are effective. When giving breaths to children, open the airway and give breaths that make the chest rise, just like for adults. However, for small children, you will not need to blow as much as for larger children or adults. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Masks for children are made the same way as those for adults, only smaller, to fit over the ill or injured child's mouth and nose. Again, you may need to put a mask together before you use it. Remember, there are different sizes for adults, children, and infants, so make sure you're using the right size for the child. AEDs work basically the same way for children as they do for adults. As mentioned earlier, depending on which brand of AED you use, there may be special pads or a key or switch for use on children less than about 8 years of age. If one of these is available, it should be used. However, if you only have an AED with adult pads and it doesn't have a child switch, go ahead and use it. It's better to use adult pads on a child who doesn't respond than to not use an AED at all. Follow the AED prompts and the pictures on the package or pads. If a child doesn't respond and isn't breathing or is only gasping, you need to give CPR. If you're not sure, go ahead and give CPR. It's better to give CPR to someone who doesn't need it than to not give it to someone who does. Since children usually have healthy hearts and breathing trouble is often the cause of a child needing CPR, it's important to get air to a child quickly if he needs CPR. If you're alone when you find a child who needs CPR, you should immediately give 5 sets of 30 compressions and 2 breaths first. Then you can go call your emergency response number and get an AED if it's available. Okay, now let's see what it looks like when you combine everything you've learned together. We're going to show you a demonstration of a complete sequence of child CPR, including the use of an AED. For this demonstration, the rescuer will be alone. Pay close attention because you'll get a chance to practice afterwards. If you find a child who may need CPR, first, check to be sure the scene is safe.
The scene is safe.
Make sure the child is lying on his back on a firm, flat surface. Tap and shout to see if the child responds.
Hey, are you okay? Can you hear me?
If not, then yell for help.
Help! Somebody, I need help!
If no one else arrives to help, then check for breathing. Check for at least 5 seconds, but no more than 10 seconds. If the child isn't breathing or is only gasping, move clothes out of the way and give 5 sets of 30 compressions and 2 breaths. Now, open the airway and give 2 breaths. Watch for the chest to rise and reopen if necessary. Repeat. After the 5th set of compressions and breaths, if no one has come to help, then go call your emergency response number or 911 and get an AED if possible. When you return to the child, turn on the AED and follow the instructions.
Attach pads to the victim's bare chest.
Continuing CPR while you wait for someone with advanced training to arrive and take over. If you don't have an AED, continue CPR while you wait. And that's what child CPR looks like, including the use of an AED. Again, the first compressions are the most effective overall, and they become less effective as you go. So remember, if another trained person is present, switch rescuers at least every 2 minutes, even if you're not tired, to make sure you're giving good CPR. And remember to give feedback to the other rescuer while you are resting, to help make sure they push hard and fast. Congratulations! You've just learned CPR and AED use for children. Here's your chance to practice everything together. The following scenes will show a variety of emergencies. It will be up to you to take turns showing how you would respond to them. We're going to include using an AED, but only to the point of turning it on, since the AED will tell you what to do in a real emergency. Your instructor will guide you, and after everyone is done practicing, you'll each be tested on your child CPR AED skills.